Welcome to Gender Queries. My name is Sam. My pronouns are they, them.
I'm Jess, and I use they and she pronouns.
And I'm AJ, and I use he and they pronouns.
In this episode, we're going to go beyond the city limits to explore what accessing trans healthcare looks like for trans and gender diverse folks living in rural, small town, and remote communities across Atlantic Canada. We're going to look at the challenges that they encounter and some community-driven solutions that exist to support those folks. I just wanted to kind of start off by giving us a picture of the numbers that we're looking at for Canadians living rurally. According to the Statistics Canada 2021 census, 17.8% of Canadians live rural, but that number is higher in Atlantic Canada. For example, in Nova Scotia, approximately 41% of the population lives rural or small town settings. In New Brunswick, we're looking at about 47%. And then for Newfoundland and Labrador and Prince Edward Island, we're also looking at well above national average with over 50% of people living outside urban centers. For many trans and gender diverse individuals, rural life is not an exception, it's a norm. So let's talk about what that means for healthcare access. What do you think are some of the common barriers that trans folks might face living rurally?
I think similar to everyone who lives rurally, just your general travel time to appointments, access to specialists, and potentially fewer options as well. So for example, if you had a family physician who was not someone that you felt comfortable seeing, there might not be that many options for alternatives. Whereas if you were in Halifax, you could potentially get an appointment with the sexual health center, things like that.
Another thing might be a lack of exposure. People don't necessarily see representation of themselves, so they might not develop that understanding or the language that they need to be able to express themselves or find the care that they need. It might take longer to know what you need if you are not exposed to it. You don't see it in the people around you.
From personal experience, having grown up rurally and gone to Catholic high school, I didn't see the queer community or the trans community represented in any way, shape, or form. And so I didn't have the language that also went with that to figure out what it was that I was feeling or provide some sort of explanation for why I didn't feel like I fit in one way or another. And it wasn't until university where I really started to see that other options existed and be able to understand my identity as a non-binary person.
Yeah, I think that's huge for people that don't identify on the gender binary. If you don't see that, then it's something that's maybe a little hard to conceptualize, especially as a young person when you're being taught about how the world works. And there's just this part of it that's missing.
My name is Cyrus. I'm originally from Plaster Rock, New Brunswick. It's an extremely rural, small logging town. And as a queer person, I originally started transitioning as a binary trans man, but I realized after I'd moved, I'm actually bigender. So it was the pressure to conform to cis heteronormativity that made me believe for 4 years I was a binary trans man.
I'm Pascale Joëlle. You can also call me PJ. It's shorter and easier to pronounce. I identify myself as a transmasculine, non-binary, gender fluid person, and I really don't care about my pronouns. I grew up in northwestern New Brunswick in the woods. My town has a little over 3,000 people living in it. I lived there until I graduated high school, and my gender journey really began to take form after. Not necessarily because I had to hide, but I didn't have any representation, so I did not know that I could go on a gender journey. I just knew I was different, right? Like, stuff was not adding up, but I did not know why. So exiting that rural environment and being exposed to more different types of folks, more people in general, more information as well, was really liberating for me.
Taken together, these experiences really show how rural contexts can shape both identity and opportunity. From not having the language, to feeling that pressure to fit certain norms, to only really coming into that understanding after leaving those spaces, it really highlights just how influential environment can actually be. But even once someone has that understanding of who they are, actually accessing that care is another layer entirely.
My name is Bast, and I use they, them pronouns. I came to Cape Breton from the US Went to Indiana School of Medicine and been doing gender-affirming care and 2S LGBTQIA care for my whole practice. And caring for the gender diverse community is my passion and my first love. I'm practicing in 3 rural locations on the island. I'm at a primary care clinic in North Sydney, and then I'm at the newcomer clinic at CBU, and I'm at the Ally Center. I have been given 4 hours of sessional work a week to see Pride Health patients. So anybody who identifies in the 2S LGBTQIA community can see me, but the vast majority of work that I'm doing is gender affirming care.
How would you describe healthcare access for trans and gender diverse folks within those communities that you're working in?
It's really hard. It's hard for people who don't have a family doctor who are unassigned to seek healthcare at all, let alone somebody who has experience and or knowledge in doing gender affirming care. So before I was doing these 4 hours, a lot of people just weren't getting care, or they were on waiting lists for providers in Halifax. Every time I see a new patient, they're just so grateful that there's somebody here who's doing the work. And they don't generally have to wait a long time to see me, a couple of weeks max. And I think people don't know where to access care. They don't know who's competent, who's not. So I think there are a lot of folks here who probably want care who are not getting it yet. We still have, I think there are 25 family physician jobs available in Cape Breton that we don't have doctors for. Plus, we have people retiring all the time. So it's not even just gender affirming care people are struggling to access, it's just care. I think addressing the physician shortage, particularly in the Eastern Zone, is going to be really important. I think transportation is a major barrier. People coming to see me in my office in North Sydney, coming from Glace Bay, sometimes have to take 3 buses, or it's an hour drive.
Do you ever see the transportation element complicated by, for example, unaccepting families or anything like that?
Oh, absolutely. And there's that too. If you are somebody who doesn't drive and you need somebody to bring you, yes, it's a huge barrier.
For trans and gender diverse folks, accessing top and bottom surgery consultations, fertility preservation, voice therapy, and even just hormone therapy providers themselves, those are often concentrated in major cities like Halifax, St. John's, Fredericton, Charlottetown. For someone living in Shetty Camp or Yarmouth or Goose Bay, accessing these services might involve driving several hours, staying overnight, taking time off work and school. These appointments are not just one-offs. Usually there are several follow-up appointments that are needed when accessing certain aspects of care. This adds up both in time and in cost. And part of that problem too is that the provincial health insurance, generally speaking, doesn't cover travel, accommodation, and meals. So it's not just inconvenient to access those services, but it's also exclusionary when it comes to those who are living rurally. Like I said, this is not something that is unique to the trans community. Anyone living rurally, if they either don't have access to a car or public transportation, which is usually very scarce if it exists at all. And then you have individuals with low income who may also struggle to access these services due to the cost of gas and accommodations. But some of the things that might be a bit more unique to the trans community when it comes to living rurally is if youth or young adults, especially those who may still be living at home, who are not out or who may live within an unsupportive environment. If they're trying to seek help, whether that's support with understanding their gender identity, whether it's mental health supports or accessing hormones, if they're not out to their family or friends or whomever they're living with, it can be extremely difficult and often impossible to be able to even make appointments or access those appointments. In a previous episode, we had this conversation about referral culture within trans healthcare and how so many aspects of care get framed as being specialized, even when they don't have to be. Because what that can mean in practice is that even if someone does have access to a family physician within their rural community, they may still be told that they need to travel to a larger urban center just to access things like hormone therapy or even initial assessments.
My name is Kaiden. I'm from a small town in Newfoundland, but as most queer people from the middle of nowhere, I now live in St. John's.
What was your first point of access for gender-affirming care?
It was the advice of a mental health nurse that I was seeing when I was living at home. I had been talking to him about mostly other stuff, but I kind of threw into the mix, hey, I think I'm transgender. And he's like, the only place that can help you is if you move to the city. Here's a card with the resources you need for your other mental health issues, but also if you might want gender affirming care, this is like the one place to go, and sent me on my way with that. Anyone who's not in one of the two ends of the province, like St. John's or Corner Brook, or there is one person in Labrador, like other than that, people have to move or they have to travel, 5 hours or more to see somebody who's willing to provide gender affirming care.
We actually see this reflected really clearly in Canadian data. The TransPulse Canada Rural Report found that 45% of trans and non-binary people living in rural or small towns have had to travel out of town just to see a primary care provider known to be gender affirming, compared to 16% of people living outside of rural areas. It's not just about accessing specialized services like surgery or voice therapy, it's actually happening at the level of basic primary care. What was really interesting is that at the same time, the majority of people in that study, around 80%, do technically have a primary care provider already. There's that really important disconnect where people have access to care on paper, but still can't access that care that is affirming, knowledgeable, or usable for themselves. When gender affirming care is treated as something that only exists in certain clinics or in certain cities, it pushes people into these referral pathways. We know from broader Canadian data that nearly half of trans and non-binary people report unmet healthcare needs. Access to provider doesn't necessarily mean access to care.
I am all about advocating that this is in the scope of primary care for a couple of reasons. One being it totally is. It's way easier to do gender affirming hormones than it is to do diabetes care. I mean, it's not a hard thing for family providers to do. And I think that one of the ways to protect gender affirming care in Canada from the kind of attacks that we've seen in the States is to lodge it firmly within the primary care system and not make it specialized care. My wife and I opened a clinic in northern Indiana, and over the next 9 years, we grew to about 4,000 patients. 1,600 of them are trans and non-binary. But Indiana is a red state, and in 2023, the state banned gender affirming care for youth, which wasn't something that we were going to let go unnoticed. So we joined with 4 families and sued the state to try to get the law to not go into effect while it was adjudicated, but then also in an attempt to just turn it. That experience was crazy. I mean, it's this wild ride of watching the courts not back us up as gender diverse people. In February of 2024, the law went into effect suddenly at 5 o'clock on a Tuesday when a panel of appellate judges in Chicago decided that apparently this wasn't harmful enough to people to keep it stayed. We started to see the writing on the wall. I mean, although we were always a family practice and we served everyone, we had sort of become the gender clinic. The predictions and the fear was valid, and many of those things have ended up becoming true. So in November of 2024, we ended up closing our practice. It became unsafe for our patients. It became an unsafe place for me as a provider. So we crossed the border to Canada on the day before the election in 2024 and have been here ever since. If the threats were to come in Canada in a way that they've come in the States, it's through politics first. It's through people who don't know the medicine proposing laws that they think are appropriate somehow and not consulting with the experts, right? What I would love is for there to be so much access to competent 2S LGBTQIA care that includes gender affirming care, so much access that family docs who hear about a political proposal that says that this care is bad, look at each other and say, huh? Why is this bad? I do this all the time. Like, how is this any different than taking care of somebody who has diabetes?
When we zoom out a bit, there's that broader social and political context that people are navigating. Even though a lot of the legislation that we hear about is happening in the States, the impact doesn't stop at the border. Research is actually showing that even in places with protective policies, trans and gender diverse people are still experiencing significant mental health impacts tied to the broader political climate. People who are worried about losing their rights have much higher rates of anxiety and depression, not necessarily because anything has changed locally, but because of what they're seeing happen elsewhere. While Canada has historically been seen as more protective, we're not immune to that shift. Over the past few years, we've seen a rise in anti-trans rhetoric here too, including policies such as in school settings that require parental consent before a student's name or pronoun can be respected. Public health research is already warning that those kinds of policies can increase distress, particularly for youth who don't have supportive home environments. When you layer that onto rural contexts, it can become even more intense. We know that trans folks in small towns and rural communities report higher levels of social anxiety, and that supports that might buffer that within urban settings don't always exist in that same way. For younger folks especially, that shows up clearly in experiences of bullying, for example. Studies have found that trans and gender diverse youth in rural areas experience higher rates of bullying than their urban peers. And when we talk about fear, it's not just internal, it's shaped by real experiences. Being targeted, being talked about, not feeling safe in everyday spaces like school, healthcare settings, or even just moving through their own community.
When you're in such a small community, sometimes making even small changes like changing the way you dress or the various ways that you can explore your gender identity, there's a lot of pressure because you can't really do anything without people knowing about it and talking about it. That even extends into the healthcare system where, the healthcare providers probably know your parents and they're probably the parents of your friends, or you play on a soccer team with their kids, and everything is so intertwined that there's not a lot of space, especially in communities that are not particularly open to that sort of thing. That space to explore isn't really there for a lot of people.
My name is Jocelyn Adams. Pronouns are she, her, and I'm the Executive Director of Gender-Affirming Care Prince Edward Island and one of the co-founders of Gender-Affirming Care Prince Edward Island. Being a province that's so small, the size is like a blessing and a curse sometimes. Definitely one of the barriers, especially in rural PEI, is these small communities where you might have a family doctor and that's great and that should be better care, but because it's the same family doctor as your parents or your coworkers and your extended family, let's face it, this is East Coast, it's small town, people talk. I know there are privacy things, we know, but this is small town stuff. Word gets around in a town where you have the admin, nurse practitioner, a physician, and then your pharmacist, pharmacy assistant, all these people all have eyes on your file and your prescriptions. There's some fear there and there's some apprehension. So we see a lot of healthcare avoidance for those reasons.
My name's Stevi Gerrior. I use they, them pronouns. I identify as a little bit of both and sometimes neither. My family's a Nook. My grandmother's a residential school survivor from Labrador, but I grew up in a very white community. One of the big challenges for me was dealing with privacy in a small town. I kept trying to explain to this pharmacist, if you just read my file, this will make sense to you. This pharmacist just kept denying me until I was forced to explain my anatomy publicly. And once something like that happens, I no longer have control about where that information goes. That made me feel unsafe and uncomfortable, not valued, all of them.
For some people, it takes going to a new area, starting a new chapter, and then starting their transition there where they don't have to explain themselves to people because you're not seeing people that have known you since you were born. You don't have to explain your story. It's just you're around new people and you can start fresh. That's why a lot of people feel like they need to wait until they get out of the small communities that they grow up in.
Do you find that some of it is also just peers? If, as far as you know, you're the only trans person in town or whatever, you might not be, but you don't have a group of people to try things out with. Usually, you try out new pronouns or anything with your friends first before you talk to people in your life that feel higher stage.
And we know that community is really important for well-being. Just having that group of people where you feel safe to be yourself and try things out.
Let's talk about some of the promising support strategies that exist to help trans folks living rurally. The most robust research comes from Saskatchewan, where researchers piloted 2 transgender peer health navigators from April 2021 to March 2022. Some of the key findings were that both clients and healthcare providers emphasized that the navigator's lived experience as a trans or gender diverse person was invaluable, and allowed them to empathize with clients and provide appropriate support. Navigators successfully connected people to services and reliable sources of information. And something else that came out of it was the expected and unexpected work that these navigators had experienced. Expected work being connecting clients to resources, but then there's that unexpected element of emotional support and advocacy for the healthcare systems themselves. Both clients and healthcare providers called for these navigator positions to become permanent within the provincial healthcare system. Something else that has become an important support for rural trans folks is telehealth and virtual care. Canadian research shows that 32.7% of trans and gender diverse people preferred virtual care post-pandemic, with preferences associated with having chronic health conditions, probable anxiety, as well as possibly a role of gender unsupportive home environments driving a preference for virtual care. Then there's that transportation element. Another important support is what we've talked about. Gender-affirming care can and should be delivered across all primary care models. That will enable us to reach more trans folks living rurally.
Pride Health here in the Eastern Zone is developing a network of mentors. I'm so happy to be a phone-a-friend. I am so happy for somebody who wants to do this work to take my phone number and then call me or text me and say, okay, just remind me, what do I do? Let's talk it through. You got it. And so I think a mentorship program is going to be a real help with confidence.
Hearing from people with lived experience really grounds the importance of these conversations. That shows us not just the impact of access, but also how those everyday interactions can either support someone or add to the weight that they're already carrying.
My name's Nikki Valentine, pronoun she, her. I am a trans woman from Cumberland County, Nova Scotia. If you feel like there's something that you may have to discuss with a trans person that may end up being a barrier to any number of things, recognize that trans people are going through barriers every single day and are encountering them at complete random. And so you should always navigate those situations delicately.
I wish that they understood how much power they hold in a single interaction. I think it's really important to name the role that healthcare providers play in all of this, because healthcare providers you interact with during your entire process of transitioning become a part of your story, whether they realize it or not. They're present at these moments that are genuinely life-changing for people. And for trans people accessing things like hormone therapy or any type of surgery, it's a huge, super exciting moment, right? When you're met with barriers or with providers who won't listen to you, or they make assumptions, and they make you feel smaller because they don't understand you. It doesn't just delay people's care. It takes the joy that this person is experiencing away from them. Even if you don't understand someone's identity, the way that you show up in that moment, it matters. You'll either be a part of the system that's already failed them so many times, or you'll be that doctor, that nurse, that pharmacist that someone remembers as part of their joy. I wish that healthcare providers understood that that choice is with you.
I remember when I had my drains removed after surgery, I had this interaction with a doctor in my rural community. I was worried maybe there was some infection going on because I had my drains in for so long, and he basically just reassured me that everything was fine, but then also gave me a fist bump at the end and said congratulations. Because he recognized this is a big thing, and that was like a 5-second interaction for him, but for me, that's something that I will always remember.
100%. Before I came home, my pharmacist in Halifax was amazing. She was constantly not only educating herself so that she wasn't putting that on me, she was making sure that her coworkers were also getting that education, so that any trans person that walked in to that place felt seen and heard and validated, and that was incredible.
I'm Fawn, she, her. I remember like the day I started, I was coming down from the clinic. I tripped down the stairs actually. The first thing I did was I took the prescription to the pharmacy. I went and got that, and the psychological burden of that is like way bigger than I anticipated, because like as
Yeah.
soon as I took that first pill, I knew there wasn't going to be like an immediate effect, but like the removal of the psychological burden there, like walking down the street and understanding what Ode to Joy is about or something, it's just there's something to it that's
That kind of relief, that psychological shift, can be so much bigger than what people expect. A big part of what makes those moments possible is the way providers show up in those interactions. Throughout this episode, we've talked about the barriers that trans and gender diverse people face in rural, remote, and small town communities. We've talked about the ways that the system can make care feel out of reach, but we've also heard meaningful, affirming care doesn't only happen in those big urban centers. And sometimes it starts with something as simple as a provider willing to say, I'm learning and I want to make this right. Because for many trans people, it's not just the big barriers that shape their experience of care, it's the accumulation of small moments. When we think about improving access to gender-affirming care in rural communities, it involves equipping and supporting providers across all areas of care to feel confident and to be curious and to show up with humility and respect. Thanks to all our guests who shared their time, expertise, and lived experience with us in this episode. You'll find more information about our guests along with their work and relevant resources in the show notes, where you'll also find access to references, additional learning material, and a full transcript for this episode.
You can contact us at genderqueriespod@gmail.com or find us on Instagram at genderqueriespod.
That's all from us at Gender Queries.